This project is titled Evaluating Mask Usage Among Orthopedic Surgeons Performing Knee Replacement and ACL Repair. So in terms of our introduction, we all know that recently we've been wearing a lot of masks because of the pandemic. However, mask usage has been fundamental in the operating room for decades. The COVID-19 pandemic has just further brought it to light a little bit. However, these protective equipments like masks, as well as other hairnets, boot covers, full aprons, etc., have been shown to be consistently effective at preventing a variety of diseases. So we just wanted to find out if practitioners were using high quality masks or standard masks, and if so, when, how often they were using it, if it was completely perfect practice or if it was not. To clarify, standard mask is acceptable in practice. However, high quality mask is one shown to have a higher rate of pathogen limitation within the mask barrier. So in terms of our methodology, we contacted 50 orthopedic surgeons and we just asked if we could conduct a very brief survey in which we asked them the quantity of mask usage as well as the quality of the usage. So we enjoyed a very high response rate of 43 of the 50 surgeons for an 86%, for which we described the results. So the surgeons first described the type of mask, and then we used this information and ran it through a list of third-party quality certifications to determine whether or not it was a high quality or standard quality mask. And then the participants of the survey also reported whether they always, sometimes, or never wore the mask. So our results showed that none of the participants said that they always wore either the standard or the high quality mask, in addition to the additional cover that is always required. Two said that they sometimes wore the high quality mask, and 33 said that they never wore the high quality mask, and then 3 said that they wore the standard mask, and 3 said that they never wore the standard mask. So the largest population again was in the never wearing the high quality mask. Of course, these were stratified for a total of 46 respondents. So in conclusion, we had a couple of findings. First of all, surgeons reported wearing masks. The majority were wearing the high quality masks because they provide the additional security even though they're not necessarily mandated. The majority didn't use issues with their usage. However, when we proposed a study and asked them to specifically identify events, it was more prevalent. We proposed that because the mistakes that are occurring are so habitual and accidental, it's difficult for them to recognize them and report them effectively unless someone's pointing them out or unless they're extremely cognizant of their own approach. We also proposed that a team-based approach and in a culture of safety where people can point out flaws without any fear of retaliation or anger is the best way to go about increasing proper mask usage, ideally high quality masks. The distribution of the errors were varied, and we were unable to prove significance for that due to a low level of power. So we do intend on doing further studies so that we can ideally find a significance and then report that, and then finally move on and change practices between UMKC and affiliates based on that information. Thank you.